Hello everyone, I'm Laura Burt with ViewPoint Center. I'm happy to invite you to a virtual version of Whiteboard Wisdom. This is hosted by Dr. Jordan Rigby. He's our assessment director, and we have a special guest this time, Amber Seeley, who is a speech and language pathologist. I'm going to turn the time over to them, and I hope you enjoy.
Thanks for joining us today on this whiteboard session. What we're going to talk about today is knowing what we don't know. And so I'm going to cover just a couple of different ideas that have to do with knowing, essentially being aware of what you don't know. So first thing I want to point out though is you probably don't know as much as you think you do. And I know that can be hard to accept sometimes, but when put to the test, most people find they can't explain the workings of even like everyday things in life. They think they understand them, but they have a hard time like explaining even how they work. If you don't believe me, let me just kind of throw out some examples. Find an object that you use daily, like a zipper, a toilet, a stereo speaker, and trying to describe the particulars of how it works. You're likely gonna discover, most people are gonna discover that they have like unexpected gaps in their knowledge of how it works. They know it works. They know there's an idea, or they have an idea of how it works, but the very specifics or the very particulars, they have a hard time really identifying how it works or explaining how it works. In psychology, we call this cognitive barrier the illusion of explanatory depth. So we have an illusion that we have a depth of understanding of something. Essentially what it means is you think you fully understand something that you actually don't, all right? And so I want to flip that to there's great power in knowing that you don't know something. When we accept our illusions or our limitations, I think we become wiser. We become, it opens up opportunities to learn more. All too often we fall into a delusion of thinking we know more than we really do. This is known as illusory superiority, and not knowing you don't know can be problems in healthcare services. When you know that you don't know something, there's a range of things you can do to improve the situation. So knowing what you don't know teaches you. There are areas in life you need to make or seek more information in. Knowing what you don't know allows you to step back and step back before making like an ignorant or like hasty decision. If you don't know something about something, it gives you pause. Also, knowing what you don't know gives you the opportunity to refer someone else who can help you. And so at ViewPoint Center, we complete multidisciplinary assessments. We try and get to know these kids, these adolescents, from a lot of different angles. But we also know that we have limitations in what we don't know, really. And so we'll often reach out to other professionals to get an idea of certain areas that are not essentially in our wheelhouse. And that's where I bring in Amber, because Amber is one of our professionals that we often invite to help us out with evaluation, the multidisciplinary assessment. And so I'll let her explain kind of what she does and how she helps us out. And maybe I'll interject here and there, Amber, if that's okay. But I'll let you take it from here.
Okay. Well, thanks for having me.
Mm-hmm.
So I definitely don't know a lot of things. I'll admit that. But I do like talking about language and language skills because I know a little bit about that. So as Dr. Rigby said, sometimes at ViewPoint during an assessment or just with interacting with some of our teens, he or another team member might start seeing some red flags that would indicate a possible language impairment. So we're gonna talk about that today. And real quick though, there's an entire speech side of all of this, which sometimes we do have some of those speech needs as well, and we have gone that route before, but today we're going to just focus on the language part of it all. So I just wanted to take a look at what we're even talking about when we're talking about language skills. So there's two main areas of language. So one of those is expressive language, and that's our output. So that's how we're able to use language to express our thoughts and our feelings. It's how we're able to talk to other people, right? So those skills would include things like grammar skills, vocabulary skills, being able to use vocabulary correctly in sentences, formulating sentences, so putting words in the correct word order to make a sentence make sense and be grammatically correct. Being able to ask questions, so turning a comment into a question if you want to ask something instead of just state something. That's all expressive language skills. There's also the receptive language part of things where that's the input. So that's where we take all of the language that's coming our way, either spoken or written language, and we're able to make sense of that information. So those skills include things like being able to follow directions, being able to answer questions. Really, it's our overall comprehension, just being able to understand what's being said. And then vocabulary is there again, but this is more of being able to understand or know different word meanings. So two kind of main areas of language there. So when we're talking about red flags, like what are these red flags that we're talking about if we're talking with one of our teens or testing and we start seeing, you know, there could be a language impairment going on here. Let's take a closer look. This is what you might see in each of those areas. So in expressive language, if there's an expressive language disorder, then sometimes these teens are going to be reluctant to participate in things. They're not going to put themselves out there. They're not going to initiate conversations as much. They might have a hard time telling a story or retelling a story. It can affect their writing skills. That's another form of output, right, with language. They might use a lot of phrases like stuff or you know, or that sort of thing when they're not able to come up with the word that they're looking for when they're talking to you. And they really could have some difficulty making friends. Obviously, if they're reluctant to participate and they're not initiating conversations as much, then it's going to be a lot harder to make friends. On the receptive language side, that might look like incomplete assignments, having a lot of incomplete assignments. Maybe they start things but don't finish them. They could have difficulty following multi-step directions. And I would say the more complex those get, the more difficult it would be for them. Reading comprehension issues. So they may actually be a good reader. It's just they're not understanding or getting the gist of what they're actually reading. Not following rules. It can come across and present as a lot of frustration or being defiant. So Dr. Rigby, do you want to add to that a little bit, how sometimes those receptive language disorders can present as a behavior issue, really?
Yeah, and I was going to say, actually, like when we get at the root or the cause of some of these things, sometimes it does have to do with language and language production or language input, like you mentioned. A lot of times we'll see kids that come with like oppositionality or anxiety, and a lot of times that is the case. But what we try and do here at ViewPoint is get an idea of where's that coming from, and at times we do see a language problem as more of a root cause. Like if you follow the behavior upstream a little bit, it starts with like language. It starts with language concerns, and that's when we bring Amber in to our team as part of that multidisciplinary assessment.
Hey, thanks. Yeah, so I think it's interesting because I think a lot of times when a teen has a receptive language disorder, those are a little bit trickier to identify, and they can be overlooked because it comes across as a behavior issue, and especially if there's solid expressive language skills that are there, we make some assumptions. If kids are able to communicate, express themselves well, we a lot of times just assume that they're understanding everything that we're asking them to do, and so it can definitely look like they're just not cooperating, they're just being defiant.
Yeah.
So specifically when there's a discrepancy between those two areas of language, I think that's when it can come out and be a little bit trickier to identify when they have.
Amber, if you don't mind me jumping in, how does it like impact treatment planning? If we can get it, language being a contributing factor, or at least a large contributing factor, how does it impact like treatment planning moving forward?
Yeah, so I mean, obviously the language component, it's a piece of the puzzle. Like you said, it's a multidisciplinary approach. And so we're all able to kind of add our little bits and pieces in there, right? So yeah, when it's a language impairment and we can identify that with specific language testing where we're able to really kind of pinpoint what areas of language are being impacted here, like where's the deficit. And when we know that, we're able to identify how, like, different ways and suggest to parents and to teachers in the classroom and as part of treatment, just communicating, like we're communicating constantly, right? So this would go just across all areas. We're able to make some suggestions and recommendations on how to better communicate with these teens, whether it's summarizing things, making sure that we're not asking loaded questions, right? Like sometimes we come at these teens, we want to know all this information, so we're just throwing out all of these questions where, you know what, maybe it's better to take a step back, especially if there's a receptive language impairment, and just simplify what we're asking them to do, simplify our instructions, give them some visuals, maybe write them down so that they can see it. And we can just, depending on the environment, we can make a lot of recommendations on how to better communicate so that they could be more successful.
Great, yeah, thank you. And then I also know you wanted to talk about some specific interventions that you do as part of treatment planning, or as part of helping these kids out with those language concerns.
Yeah, so a lot of times at ViewPoint, we do the assessment part of things, and depending on the timeline and that, we can actually do one-on-one speech therapy as well. So if we notice a deficit, we can address that, and we can work on whatever it is that they're having a hard time with in their language skills. We can work on specific expressive language skills. We can work on receptive language skills, finding the main idea, being able to summarize a bunch of those skills. And it just really depends on what those scores show us. We're able to get a pretty good picture on where those holes are in language, and then just personalize a plan for them. Mm-hmm. So yeah, and that can be with individual speech therapy where we're addressing these language skills, but at the same time, all teens at ViewPoint participate in our social skills groups. So that's another area of language that sometimes we don't realize is part of a language skill, right? The social aspect. There's a whole social language, how we use language in social situations. And while teens that have an expressive or a language or a mixed receptive expressive language disorder have difficulties making friends, have difficulties communicating, I really feel like the social skills groups that we have are beneficial to all. Like I know I benefit from them. I learn a lot from these groups.
Good for everybody. Yeah.
I agree. So that's one area that all of the teens at ViewPoint are able to participate. So we have a social skills group once a week. I can kind of let you know how that looks, how we run those groups. We have a focus. I know there's different ways to run social skills groups, different focus areas of focus, I guess, but ours are all based on becoming a more effective communicator. So everything that we talk about, at some point during the discussion, I will probably ask, and how can this help you become a more effective communicator? Because that's what we're focusing on in those groups. So a little bit about those groups. They are weekly, and I put up here the Peers Social Skills Program. That's a specific program that I'm a fan of. It's from UCLA, and it's very research-based and evidence-based. So I can tell the kids that we're working with, this is proven to work. Like just with anything else, any skill that you are trying to improve, if you practice, you're going to get better. And it's the same with any of these social skills that we work on. So I do use, I have become a Peers certified provider because I really am a big fan of that program. You know, it's a pretty well-known program, but we do add to that, and we are able to take a good look at the individual needs and the group needs. And that changes with the groups that we have at ViewPoint, but we can personalize those groups. We can pick topics based on needs, but some of those topics that we do address are things like conversation skills. So being able to start a conversation. How do you know when to join a conversation, and how do you leave a conversation? Being able to make friends and keep friends. Perspective taking, being able to recognize and be aware that even in the same situation, everybody can have their own perspective and own point of view on a situation. Problem solving skills, sportsmanship. We talk about humor, like when is that appropriate and when is it not appropriate? That also, we even go a little bit into like sarcasm. What does that mean? And understanding different types of humor.
Mm-hmm.
A lot about emotions, our thoughts versus feelings, nonverbal language. We get into that, but we really take all of these a step further. So we talk about not just emotions, but we talk about thinking and thinking about language and how we're using language. So we really get deep into, you know, those metacognition skills and metalinguistic skills and discuss some of those things. So that's kind of how we implement those social skills groups. But we start with learning. We have lots of really good discussions. We do a lot of role playing, either as a group or we'll break up into smaller groups sometimes. And then the implementation part. And I wanted to point out at ViewPoint, I was just talking to some of the staff last week after our social skills group, because our staff they're present during these groups and they participate, they're engaged in our groups as well. But ViewPoint really has this unique opportunity with the implementation of these types of skills. You know, a lot of times when we're doing a social skills group, we discuss, we role play, and we do all of those things, and then everybody leaves. But at ViewPoint, we're staying there. So they have support all week long with staff and their therapists, and really everybody at ViewPoint just kind of works together, and we're able to reinforce those skills and support the implementation of that to where they're able to really address those skills that we've just discussed in real life situations, which is, it's just awesome. I just love that they're able to really take that and implement that in real life situations and then come back and report back.
Yeah, our staff, I consider them like our coaches. They do such a good job of giving feedback, real-time feedback, and they really are our secret weapon for sure. So, well, thank you so much, Amber. This has been super helpful. We're always excited to bring you into our team and see you for our social skills groups. Thank you everybody for coming for our whiteboard session today. If you have any questions, always feel free to reach out to us at any time to answer those questions. Thanks everybody. Bye-bye.
Bye.